doesn't mean we stop giving you insulin.
So that said, and I appreciate your response, Dr. Patel. Do you remain concerned about the politicization of this crisis? You're saying that it's a multifaceted approach needs to, be applied. I think I'm hearing that from you, that it's not a one size fits all, but prescribed safer supply is one of the tools a physician can use to help support their patient. Are you concerned about the politicization of it? I mean, you don't see politicians getting involved in heart disease or diabetes. Do you, and every party is saying that this is a health issue. But do you see that being applied in terms of what you're hearing from politicians?
Yes, I do. And it's unfortunate because, substance use disorders, as you've alluded to, transcends political ideology and partisanship. The patients don't ask me what my political affiliation is before they let me examine them on the street. I don't ask them. But yes, it is very definitely become a political issue. And can I just share why I think it's become more of a political issue? It's become more of a political issue because you are now seeing more people on the street using drugs, whereas before they were in safe consumption sites. And that's because the way drugs are used, the availability of drugs, the types of drugs that are actually available, means that they no longer can take one injection of heroin and get on with their day, go get a health card, find a house, go get money from the bank like the rest of us do on a day-to-day basis. They now have to spend all their time doing that every hour. And because of that, it's become a visible problem. That's the issue, and that's what's driving politicians to make it a political issue because, as you very clearly said, I've yet to hear a politician come down to the ICU and tell me how to manage a critically ill patient. Yet all politicians from a variety of different partisanships feel no issue telling me how to do my job at the corner of Murray and King Edwards, right? Because it's visible. And the reason it's visible is because the types of drugs that people use have fundamentally changed. They are so rapid onset, so short acting, that patients have to go and get the next hit. Let me just explain to you this very quick way. Patients who are on, who inject drugs, smoke drugs, however they choose to do it, they know that what they bought on the street, they have no idea really what they bought on the street. They may have bought fentanyl or at least been told that there's fentanyl in there, and you've heard from the other physician that there's lots of contaminants. They know that when they smoke that or inject that drug, that they may very well die. However, they've experienced withdrawal, and withdrawal for them is a fate worse than death. So basically, they're taking a handgun with a single bullet, spinning the chamber, and doing whatever it is they need to do to avoid withdrawal. They would rather die than go through withdrawal. And that is part of the problem. That's how potent and sinister the drugs are on the street, and therefore no one single approach is going to solve this problem for us. It just can't.
Thank you, Dr. Patel. Thank you, Mr. Johns. Next